Listener, and welcome to you to this very special interview in the studios of Radio Maria Zambia. In this interview, I will be talking to three gentlemen from the American Embassy in Lusaka. And let me start first of all introducing to you Michael Koplovsky. Michael is
very well done.
Yes, Michael Koplovsky, who is the Deputy Chief of Mission, Embassy of the United States of America. Michael, welcome to Chipata and Eastern Province.
Thank you so much, Moses. This is really wonderful. Thank you for having us here. I'm
Thank
most
you.
pleased.
Thank you. And second in the studio is Lawrence H. Marum, who is the Director for Center for Disease Control in Zambia. Lawrence, welcome to the program.
Thank you very much. Delighted to be in Chipata.
Thank you. And finally, I have Nick Sadoski, who is the Political Economic Officer under the U.S. Embassy right there in Lusaka. Nick, welcome to this program.
Thank you, Moses. Thank you for having us.
And in general, I welcome you to the three of you gentlemen. I welcome you to Radio Maria Zambia. Thank you for giving us such an opportunity. Thank you.
Thanks.
Thank you.
Yes. Now, a lot of projects and programs are being carried out here in Zambia and Chipata, to be more specific, with the support of the American people. Okay, so in this program, we will get to know some of the projects and programs that the American Embassy is supporting. My name is Moses Ngoma in the studios of Radio Maria Zambia here in Chipata. I'll start with you, Michael. First of all, give us what are some of the projects and programs that are supported by your embassy here in Zambia?
Well, thank you very much for the opportunity to discuss with you some of the programs that are here. As you said, the American people have partnered with the Zambian people to address some of the issues which are here in Zambia, some of the challenges and some of the opportunities. And they're in three main areas. The first area is in health. Our presidential malaria initiative has been working with Zambians, distributing bed nets, distributing diagnostic kits so people know when they've come down with malaria, supporting Zambia's indoor residual spraying every season. And I read in the paper today, I'm very happy to see Zambia has met or exceeded all of its goals in malaria reduction, thanks to that kind of partnership. Also in the President's Emergency Plan for AIDS Relief, HIV/AIDS, we've been working very broadly on counseling and testing, on treatment, on helping orphans and vulnerable children, those most affected by the disease. We've been working recently with an increased emphasis on prevention, that nobody really needs to get HIV if they take proper measures to prevent spread of the disease. And again, we've met many of our goals in terms of getting Zambians on treatment, in terms of spreading prevention messages. We also work in child and maternal health and broader health engagements here. The second area we work in is education. And here we're helping Zambia, working with Zambia, to meet its Millennium Development Goal of 100% primary education for all Zambian children. And Zambia is well on its way to meeting that. And we've helped through programs such as Changes 2, that trains teachers and community educators, and also through radio broadcasts like the Learning at Tonga Market program that reaches community schools in some very remote areas. Children in villages who can't get to the government schools can nonetheless in community schools learn to read, learn to write, learn their numbers, learn the life skills they'll need to be productive Zambian citizens. And the third area is in economic growth. A prosperous Zambia will be a successful Zambia. Mm-hmm. We want to help people in Eastern Province and throughout Zambia to be more productive. We want to create opportunities for creating incomes, for creating wealth, for generating it. We're doing this through agricultural programs to help with herds for people that have cows, milk cows or beef cows. Through people who have been growing corn, we're introducing new crops and new ways of doing things that are more productive. We're trying to bring new foreign investors here. I see that here in Chipata that Dunavant and Cargill, two large American companies, have invested here in Chipata. Mm-hmm. And we'd like more American companies to come in, mm-hmm. provide that kind of stimulus, mm-hmm. and to employ more Zambians. Mm-hmm. So these are some of the projects that we've been looking at while we're here. Too often we sit in our office in Lusaka and we read reports and graphs and statistics and go to meetings at government buildings in Lusaka and talk about it. And we really need to come out here, come out to the provinces, come out to the villages, come out to Chipata and see what's really going on, how the American people's partnership with the Zambian people is really happening. And we appreciate the opportunity to come out here. We've been so welcomed. The hospitality of Easterners has been great. It just means you're probably going to receive more visits from people from the embassy.
Thank you. Now, just in that thought, Michael, I'll go to you, Lawrence. Why the focus on health, first of all, before we even move on to education? Why do you see the need to have health as one component that the American people should bring to Zambia?
Well, many of Zambian people suffer from ill health. Malaria is still the greatest killer, although we hope that malaria rates are going to go down very quickly with the initiatives being taken by the Ministry of Health here in Zambia. HIV/AIDS, with 14% of adults infected with HIV, with 11% of couples discordant for HIV. This is an urgent issue that threatens health and threatens families. The U.S. Centers for Disease Control and Prevention is part of our Ministry of Health, and we're partnering with the Ministry of Health here and with the Provincial Health Office in Eastern Province and the various districts in helping with HIV and AIDS, strengthening the health facilities for protecting pregnant mothers who were HIV infected and preventing the spread to their unborn children. We're helping with care and treatment and working with the entire province in order to improve the health of the people in the province.
Dear listener, this is a special program, and the program is live, and in the studios I have three gentlemen. Michael, who is the Deputy Chief of Mission or the Deputy Ambassador, and I have Lawrence, who is the Director for Center for Disease Control, and also Nick, who is coming from the Office of Economics or Political or Economic Officer. Now, Nick, what kind of assessment do you undertake before you can fund or support a project? Maybe the Michael can answer that. Yes.
Well, Nick, I think, is looking more broadly at what's happening in Zambia, what kinds of policy environment there is here. He's been looking at the democratic process in Zambia. Zambia's had a long history of stable and democratic transition of government and the economy here, the policies that Zambia's undertaking. He's not really been working so much on the project side, of the development side. Those are other colleagues of ours from USAID and from some other of the embassy offices.
So can you answer that? What kind of assessment do you undertake before you can think of supporting or funding a project?
Our entire development agenda here is done in cooperation and coordination with the Zambian government. The first step is to really negotiate and coordinate with the Zambian government, the representatives of the Zambian people, for what is most needed and most wanted here. There has to be ownership. There has to be stakeholdership. It has to be something the Zambian people want and need before we even begin on this. Then as we design a program or a project, we draw on the best practices, the past successes and failures of other projects around the world and in Zambia, to try to design a project that we will think will have the best impact, the most bang for the buck, for the US dollar that we'll be spending here. And then we try to identify partners that we know have a proven track record and that are committed and are passionate about trying to achieve some of these goals. And I think with all of these elements together, we can design programs and projects which really will make a difference in Zambians' lives as we invest in Zambians, invest in the health, invest in the education, invest in the welfare of Zambians for a promising future.
We are passing through difficult moments when you talk about the economic crunch we are facing. Now, Nick, how easy do you think it is to carry on with the projects